January is Cervical Health Awareness Month. More than 14,000 women in the United States are diagnosed with cervical cancer each year. Our health expert, Dr. Payal Kohli, joins us this morning to teach us a little bit more about it and how you can prevent it. It's so important that we talk about it because this is one of those cancers that it's really kind of hard to detect.
Hard to detect, but easy to prevent. You know, so cervical cancer is one of those rare cancers. In fact, it's caused by an infection. We don't have a ton of cancers that are caused by infections, but cervical cancer is one of them. So almost all cervical cancer is caused by a virus called human papillomavirus, or HPV. And what happens is if you're sexually active, you get infected by the virus. It sort of lives inside of you, and about half of HPV viruses are these high-risk viruses that cause changes over time. They sort of cause our cells to mutate. And because the cervix, which is, the opening of the uterus, is so hidden, there's not really a lot of symptoms associated with cervical cancer. So it's really important to actually get checked regularly to diagnose it early.
How are you checked for that?
Pap smears. So, really it doesn't matter when you start becoming sexually active, but they recommend Pap smears starting at the age of 21. And then depending on the findings of your Pap, every few years or every year thereafter. If you've had more abnormal PAPs in the past, then you need to go more often. If you've had normal PAPs, then you can actually space it out up to 5 years. You get checked until you're about 65. And it's a virus that causes changes slowly. So it takes a lot of time. But the most important message here is to not wait and miss your PAP screening, because you really won't know until it becomes much bigger, which could then affect your fertility, your ability to carry a baby. And, of course, it can spread.
Are there any other signs or symptoms aside from what can be caught in a Pap smear?
Not really.
Wow,
and
that's what's
why
scary.
It's so important, yeah. And we can prevent cervical cancer now in 2023, and that's the message I really want to send, is that if we start to vaccinate our children early, and we're talking age 11 or 12 is when they suggest vaccination, both male and female children, because there are other types of cancers that can be caused by HPV, such as anal cancer, oral cancer, and other such cancers. So you want to do it before they've been exposed to the virus, because that's when it's most effective. You get them vaccinated early, you actually protect them against getting those high-risk viruses. Now, some of us will get infected with that high-risk virus and be able to clear it. But if we have a compromised immune system, if we smoke, if we use birth control pills, all of those can affect our ability to actually clear that HPV virus from our cervix.
That's what I was going to ask you. And I know HPV is so common. And so if you've had HPV, doesn't mean that you are going to get cervical cancer. It just means that you are at higher risk.
And it depends on the type of HPV, because there's some higher risk HPVs and some that are lower risk. And so I would say some cause conditions like warts, for example, whereas other cause atypia or cellular changes. So all HPV doesn't mean you're going to get cervical cancer. In fact, even the high risk HPV. So when you get a PAP, they sometimes also do an HPV test, which tells you whether you have a high risk HPV or not. And even some of those you could potentially clear. But the most important thing here is prevent, prevent, prevent. But if you've already been exposed and haven't been vaccinated, or you still get infected with HPV, then just make sure those screenings are followed on time, because it's really important to stay on top of it.
So many people missed those screenings, especially during the pandemic, and this is a reminder that you really have to stay up on those yearly screenings just to check it off the box. Peace of mind.
Exactly. And make a list, make a calendar, get it done so you don't have to worry about it. And it's important for your partner as well, because as I said, it's not just women with cervical cancer. Men can also get HPV-related cancer. So maybe you can even go and get screened together for certain conditions. If you're positive and your partner is positive, go talk to your provider and see what you need to do.
All right. Dr. Kohli, thank you for coming in.